Right, welcome along. Today we are speaking to Dr. Susanna Unsworth, who is one of our resident GPs. Susanna, over to you.
Hi, yeah, so I'm Susanna Unsworth. So I'm a GP part-time and I also work part-time in a breast clinic, but I've got a strong interest in women's health and I've done lots of further education over the last 10 years, really, expanding my knowledge in women's health things. I've become really interested in it. So hopefully I've got some helpful tips and advice that people might be able to take and hopefully improve their experience, really.
Awesome. So, bearing in mind that this month we're talking about fatigue, how can HRT help with fatigue as a symptom?
Yeah, sure. So, I mean, I see a lot of women who complain of fatigue during the perimenopause and beyond menopause as well. So, HRT can help, I would say, in two different respects. So, a lot of the time, hot flushes and night sweats are a big factor. So, women are not sleeping well at night time. And so, HRT is really good at helping resolve those symptoms. So, hot flushes, night sweats generally improve dramatically once someone starts on HRT. So, if that's the biggest reason why people are struggling with fatigue because they're not sleeping well at night time because of night sweats, then HRT is a really good treatment choice for that. The other thing that I find as well, though, is that women often find it's just hard to get to sleep. So it's not necessarily a hot sweat or a night sweat that's causing their sleep deprivation. It's sometimes that they just physically can't get off to sleep. And one of the things that I find really helpful in this situation is to use an HRT that contains taking the progestogen element of it in the form of micronized progesterone. So there's different ways, obviously, that you can take HRT. There's lots of different types of HRT available. But micronized progesterone specifically has a really beneficial effect on sleep. You take it at night time, and often it will help people get off to sleep. So it has the benefits of improving the night sweats and hot flushes, but also actually helps people get off to sleep on its own. So they're the two elements of HRT that I think can be really helpful with fatigue issues, particularly if they're caused by sleep problems.
If you had a perimenopausal woman presenting in your clinic who, for whatever reason, couldn't take HRT, whether that's for a history of breast cancer or personal choice, whatever, what
Yeah.
other things might you advise for them to combat the fatigue?
So, I mean, I think I might want to make sure that there isn't any other reason as to why they are becoming fatigued. So, obviously, we're putting it down probably to perimenopausal symptoms. But I think if it was the first time I'd met someone, I'd want to make sure that there wasn't any other reason, any other medical reason why they might be suffering with fatigue. So, obviously, making sure that they're not anemic, checking things like their thyroid to make sure they're not suffering from an underactive thyroid, because things like that can often present at a similar sort of age. Women are often affected by hypothyroidism, and it can sometimes just present with lethargy, tiredness, that sort of thing. So I guess as a first thing, I'd want to be making sure that I'm not missing some other medical reason. But I guess if we have decided that we think it's all related to the perimenopause, and if HRT is an issue, again, it might depend a little bit on the reason why they're fatigued. So if it is to do with hot flushes, there are other non-HRT things that can be beneficial to help with hot flushes. If I'm talking from a medical point of view, we do sometimes use SSRIs, which are type of antidepressants, which, although the evidence to support their use is a little bit, it's not great, but some people do benefit, particularly with hot flushes, from taking those sort of medications. And if HRT is contraindicated or people don't want to use it, potentially we could consider something like that. But if we're thinking along the lines of maybe trying to avoid medication, I think a lot of women would like to try and manage things without resorting to medication. There are other therapies that can be helpful. I mean, CBT has been proven to be really effective in helping with hot flushes. And if that's something that's causing the sleep issue, then maybe looking at something along those lines might be worth considering.
Presumably, then there's also the usual lifestyle advice as well. So eating more healthily, take some exercise, cutting back on alcohol, the same advice as we're always getting.
There's this term that we call sleep hygiene.
Yeah.
Around, but so yeah, it's looking at lifestyle things that are going to be affecting your sleep. So caffeine is a really big one that I often stress to people. So as you get a little bit older, caffeine actually can affect you more and more. So maybe when you're in your 20s, you could drink coffee till sort of late into the afternoon and it not affect you. But when you get into your 30s and beyond, actually caffeine, it's a really powerful stimulant. I don't think people realise just how powerful it can be. And for some people, if they drink anything caffeine containing after midday, it can really affect them sort of later in the day. So I would often encourage people to avoid caffeine, particularly after lunchtime, really, to make sure that that's not impacting on things. Looking at things they're doing before going to bed as well. So things like looking at iPads, anything that stimulates the brain is not going to have a beneficial effect if you're then trying to get to sleep straight afterwards. So yeah, it's looking at different things that you can impact on your day-to-day life that will help when it comes to trying to go to sleep at night. And I'm sure there are lots of different things that I'm probably not necessarily the best person to kind of go through all of those, but there's definitely lots of lifestyle things that will affect you being able to get to sleep at night.
Yeah, I've also recorded a webinar with a lady who is a sleep doctor, so she's covered off a lot of the sort of the sleep hygiene stuff and things very well. So one last question for you for now. I'm sure we will be recording lots more webinars in the future. I'm hearing from some of the ladies in the group and things that in some surgeries they're struggling to get to a doctor who is helpful, who is understanding of this. Is there usually in a surgery one person who is a women's health expert in your experience, or is it a bit hit and miss?
Fortunately, it is a little bit hit and miss, and it depends on the practice. So practices range from being tiny little kind of rural practices where they may only have one or two doctors to kind of much bigger practices, and even practices that are all linked together. I think unfortunately it is a little bit hit and miss, and I know it's difficult, and we expect our GPs to be able to provide all the help and advice for every aspect of someone's life, really. And the way in which things are going, it's just impossible for individual GPs to be able to offer such a broad knowledge base on everything. So, I mean, I'm very interested in women's health, but if someone came to see me about some men's health issues, I may not be quite as up to date as I am with all the women's health things that I'm doing. Not to say that I wouldn't be able to help them and hopefully direct them to where they can get that information. And I think maybe that's the issue. I think we need to be, looking at ways in which, if we don't know how to manage a certain patient, is being able to direct them to someone who can. And I think that's the way in which it really needs to be sort of addressed. But I would say for most large size practices, I would expect there to be a couple of GPs who would have more of an interest. And I think if you are going to see your GP specifically thinking that you may have some perimenopausal or menopausal issues, it's definitely worth asking at the reception if there is a doctor who has a special interest in that. Because often lots of GPs will have little special interests in certain areas, but unless you ask, you won't really know. And I know in my own practice, because I've developed a special interest, I now see women that have come to me saying, "Oh, I know that this is what you're interested in," and I guess it's just because the word of mouth has got around saying that that's what my interest is in. I suspect that in lots of other places. So it might be that, just asking at the reception for who might have an interest.
I guess we're all brought up to believe that all doctors know everything, which is it's sort of a societal thing that, well, doctors must know everything because they went to medical school. But actually, we have to be responsible for our own health. When you speak to the receptionist, you have to ask for who's going to be the correct person to speak to. And it may be that your family GP, who is great with all sorts of things, actually doesn't have this specific area of interest for whatever reason. But actually, Dr. whoever in the next door room is who you need to see for this. And I don't think there's any shame in that. I think that's us. We as the patients should be, I think, at least taking a bit of responsibility for how we get care.
Yeah, I think that's perfectly right. Exactly what the situation should be, really. And I think it is getting more and more like that. And I think a lot more work is coming into primary care. So we're expected as GPs to be able to deal with a lot more issues than maybe we were 10, 15 years ago. I mean, actually, even when I trained as a GP, the amount of stuff that we're dealing with now is significantly higher. So I think it is important to try and make sure you see the right person for the right problem. And it might be, yes, that it's not going to be your usual GP that you see regularly and that you know well, but initially you could see them and then you could ask them, is there somebody in the practice who you would recommend I could go to talk about this, and hopefully they would be able to direct you. But I know there's lots in the media at the moment about trying to improve education around menopause, and I think that is actually really important. So although I'm saying yes, it's about trying to see the right person, I think on the whole, as GPs and the education that we get in general practice on menopause, I think is poor at the moment. So a lot of the stuff that I've done is kind of off my own back. I've done extra training in my own time. I don't think there's enough of it in actual GP curriculum at the moment, considering it's going to affect every woman.
I think further to that, I think there's not enough of it, and it's changing, but I think it's not talked about enough across the board. And and this is one of the founding reasons why the hub exists, is because actually, if all of us coming up to this phase can be ready for the fact it's happening, then we can actually save a huge amount of GP hours by not continually presenting with a mismatch of things that, yes, I accept that we should always be getting the blood tests to rule out thyroid issues and other stuff. I totally and utterly agree with that. I know from personal experience and from speaking to a lot of people that there are quite a few of us, and this needs to change societally. This isn't necessarily just a medical thing. Quite a few of us who, because we perceive ourselves to be too young for this to be happening, we don't add up the dots. And because there's not the societal conversation around it, and there's not the inbuilt education about it in medical school, it's sort of a meeting of, it's a sort of a perfect storm of actually a lot of unnecessary appointments being used up that could have been used for someone else, and it's not just in the UK that the medical system is stretched, is it? I mean, it's everywhere. So the more we can just talk and talk and talk and talk and talk and talk and talk, the better.
Yeah, definitely. And I think to get women just being aware of it themselves as well, like you say, and taking away this kind of attitude that you have to be a certain age. I've seen women early 30s in my practice that are going through menopause, so it's nothing to do with age. And I think if you ever get told, you're too young, then you're definitely not seeing the right person at that stage. I think you need to talk to someone else. Yes, obviously most women it does occur later, but there's a large percentage of women where it can start to occur earlier. And I think age is definitely nothing.
Brilliant. Thank you so much for your time. That's been really informative. Thank you very much.
Thanks. Bye-bye.